Start recording. I'm Kush Desai. I'm an internist in Albany, Georgia, and I'm the lead on this ECHO project. Dr. Patton, Dr. Islam will be serving as co-facilitators for this ECHO session. Just so we can know each other, if everybody can please put their name, name and location of your clinic, and what your role is at that clinic, as well as your email address. We already have some examples in the chat. First, let me go ahead and start today's agenda. So we're going to start with introductions. Then we're going to have a didactic presentation by Dr. Gloria Coronado. Then Kyle Kennedy, Martin Sheldon, and Paul Dorset of East Georgia Healthcare Swainsboro will follow with the case presentation. And then we'll have wrap-up and announcements. We also have Dr. Claudia Gulian, Lorianne Aldambo, and Samia Ibrahim managing the controls. Let me introduce Dr. Doug Patton, who will take over today's session. Dr. Patton is the Dean of the Southwest Georgia Regional Campus for the Medical College of Georgia and has spent most of his career as a rural general surgeon. Doug?
Thank you very much, Kush. Again, I'm Doug Patton, general surgeon practicing in rural South Georgia. Many of you are practitioners with community health centers, and I always like to drop in that I'm a proud board member of Albany Area Primary Healthcare. I believe in the mission of the community health centers completely. Just as a few reminders, we've already got the slides up for the presentation, but just a few things about ECHO. This is an educational platform. The purpose of the ECHOs is for us to share information. It's not a patient consultation. So we do remind you to please not divulge sensitive protected healthcare information. If there are questions or issues around that, always you can, as with anything, you can put those questions in the chat or you can let us know by raising your hand. There are some things about the use of the Zoom platform that we're all sort of familiar with, but we might need to be reminded periodically. If you're not speaking, it's important to mute your microphone and then to remember to unmute your microphone when it is your turn to speak. We do ask that you keep your cameras on at all times and that you use the gallery view so that we can all see each other throughout the course of the meeting as much as possible. This is part of being able to get to know each other as we sort of develop this learning community. Again, the chat is open for you to ask questions. We will have time after the presentation and time after the patient presentation for questions and comments and things like that. We will open that up at that time. If you want to speak, we ask that you use the raise hand function, and to get there, you go down, you just hover over the bottom of your screen and you'll see the reactions button. If you hover over that reactions button, one of the options will be to raise your hand, but you can also use it to applaud or give a thumbs up or anything like that if someone says something that you're particularly excited to hear about. Same thing with the chat function, just hover over the bottom and you'll see the chat window pop up when you click on that. That is pretty much the gist of the ECHO reminders. Again, just one last reminder that the session is recorded and that by participating in the session that you're giving consent to be recorded. We do use the information from the ECHO platform for our own educational purposes to improve the program and offering that we're providing for you, but also so that we can do research on the effectiveness of the model itself. So we use it not only to study what we're doing, but to also improve so that your experience going forward will be the best it can possibly be. With that, I'm going to take advantage of this opportunity to remind us, if we could throw up, well, I guess just put it back in the chat again one more time, the link to the pre-survey. We do a pre-ECHO survey kind of to see where we are before we start the session. And we might actually just hold off a couple of minutes here. There's the survey. Thank you, Claudia. There's a link in the chat to that survey. If you don't mind, we'll take just a second to allow those to complete that survey if they've not quite done that yet. give a few seconds here for folks to get started on that, and then I'll come back and introduce our guest. See some familiar names over in the chat. Dr. Homadike, good to see you. Well, if you haven't finished the survey, go ahead and continue to work on that. But what I want to do at this point is to take this opportunity to welcome our special guest today. Dr. Gloria Coronado is the featured speaker today. She's an epidemiologist with the Mitch Greenlick Endowed Senior Investigator. She is the Mitch Greenlick Endowed Senior Investigator in Health Disparities at Kaiser Permanente Center for Health Research. Dr. Coronado's research is focused on understanding and addressing disparities in the occurrence and burden of disease in underserved populations. She has a special emphasis on the Latino population in the Pacific Northwest. She's developed several innovative and cost-effective interventions to improve rates of participation in cancer screening among Latinos. She co-directs the STOP CRC program, a program that uses systems-based approaches to raise the rates of colorectal cancer screening in federally sponsored health centers in the Pacific Northwest, specifically Washington, Oregon, and California. Her talk today is about another one of the evidence-based interventions, specifically patient reminders. The presentation will last for about 20 minutes, and then we will have a few minutes, hopefully, for questions at the completion of that. Again, during her presentation, feel free to enter your questions or comments into the chat because we'll be monitoring that. Dr. Coronado, thank you for joining us today. I see you've got your screen up and we'll turn it over to you.
I do. Thank you very much for that wonderful introduction. And it's great to see some familiar names on this list, like Dr. Hotz and others. So thanks for attending today. I'm going to talk specifically or mostly about text-based patient reminders. And this is important because we know that patient reminders is an evidence-based intervention to raise the rates of colorectal cancer screening. And I think it's important to think about text message reminders because they reach a lot of people and they have tremendous potential to effectively reach especially underserved populations. So what I'll be talking about today is really the use of text messaging to remind patients to use colorectal cancer screening. So I know I already received a great introduction, but with regard to colorectal cancer screening programs statewide, I do provide technical assistance to the programs in Washington, Oregon, and California. A lot of the assistance I provide is simply in training the medical assistants, community health workers, training of providers. I provide the evidence behind evidence-based recommendations, share learnings from the field, and then we do have a variety of materials that are on our website called mailedfit.org, and our group tailors materials for your site. So if there's any materials on that site that you guys like and you want your logo, your telephone number put on those materials, feel free to reach out. We do have graphic artists that can help make that happen. And then we do have a patient navigators program. And so we offer tools and training for patient navigation. And then just by way of conflicts of interest, I have served as a scientific advisor for Exact Sciences as well as Guardant Health. So in today's presentation, I'm going to talk about the importance of patient reminders and what we know about their effectiveness in promoting colorectal cancer screening. I'm going to talk about how to tailor those reminders for your particular population, and then give you some examples of how to use reminders in an innovative way. So by way of the importance of reminders, I want to talk about the program at Kaiser, Northern California. So Kaiser Northern California has a colorectal cancer screening rate of about 82%. So it's reached kind of the recommendations and benchmarks that are set by the National Colorectal Cancer Roundtable. But the way that it does this, I think, is really informative. So about 40% of those patients who are up to date on screening are so because of a prior endoscopy, so a prior colonoscopy. There are 20% of those patients that are up to date because they completed a FIT test that was mailed to them, and 10% of those who did it because of automated reminders. And then there's another 12% that are up to date because of a phone call that they got from their medical assistant. And this is based on kind of audit and feedback reports that are given to the care teams that they can use to make outreach calls to patients. And so I think what you see here is it's not one silver bullet that resulted in getting Kaiser to 82% screening rate. It was a variety of factors, of which reminders was one of them. So you have to think about reminders as a way to boost an add-on to an organized screening program that can really help you get to that finish line of over 80%. So I'm going to talk just about a couple of studies that my team has done. This is a study that we did in collaboration with a big federally qualified health center that's headquartered in Los Angeles called Ultimate. And what we did is that we took patients who had never completed a any type of colorectal cancer screening, and we randomized them to either receive a text message or a live phone call. And these were actually delivered before we mailed them a FIT test. And so I think what you see here is really the reach of a text message versus the reach of a live phone call. So the text message was successfully delivered to over 80% of the patients to whom it was sent, whereas the live phone call was successfully delivered. There was a discussion that happened in 36% of the cases, and in about another third, a message was left, but the patient was not reached in about 31% of the cases. And so I think what you see here is a really interesting story where text messaging has a broader reach, and we know it's way lower cost than a live phone call. But a live phone call perhaps delivers a more intensive intervention to a smaller group of people. And so I think it's important to think about weighing the benefits of different reminder modalities. And so when we looked at the data, so as I mentioned, we randomized patients to either receive a text message sent before a FIT kit or a live phone call to talk to the patient about the importance of screening. What we found is that for those text messages that were delivered, the response rate was 15%. So 15% of those patients returned their FIT kit. And so the reminder here is that these are patients who are pretty resistant. They've never done screening before, right? And so I think in programs where you have patients that have done screening before, those response rates are much, much higher. But in this case, these are a more resistant, unaware population. 15% of them return their kit if they'd received the text message. And for the live phone call, it was a really mixed bag. So there were those patients who were not reached by the live phone call, and their response rate was only 10%. There were those who were reached and left a message with the live phone call, and their percent return really matched the text message. And then there were those who spoke to somebody, and that return was 30%. And so I think what you have here is a really interesting story where you can say, obviously, that live phone call discussion did make a difference. So 30% of those patients returned their FIT if they actually spoke to somebody. But leaving an automated message and delivering a text message actually resulted in the same response rate from patients. And so what we see is that in some ways, sending a text message might be a lower cost option, in which case it's just as good as an automated phone call. Here's some of the published literature on patient reminders. There are a couple of systematic reviews that were done. Both of them were published in 2019, but most of them focus on written reminders. And I think that there's a dearth of data on really the effectiveness of text messaging and other more contemporary modalities for reminding patients about the importance of colorectal cancer screening. So I want to talk next about tailoring reminders. And so this is another study that was done by my research team. And it was done in collaboration with a large federally qualified health center headquartered in Seattle called Seymour Community Health Centers. And in this study, we identified nearly 3,000 patients who were mailed a fit and were due for a reminder. And the clinic was really interested in determining which type of reminder would result in the greatest effectiveness. And so they wanted to test out a letter, a text message, an automated phone call, a live phone call. And then they said, you know what, but we also want to combine strategies. So we want to also test an automated call and a live call, a text message combined with a live call, and a letter combined with a live call. And so I think there's some really interesting findings here. So overall, we see, if we look at the comparison between the blue bars, which represent the Spanish speakers, and the orange bars, which represent the English speakers in this federally qualified health center, we see that for each of the modalities, that there was a higher return rate among Spanish speakers and English speakers. And in fact, that return rate approached 50% for Spanish speakers in the modality that was the most effective, which was a combination of the auto call and the live call. And one thing to note here, so you may already be impressed with a 50% return rate, but I have to add that 10% of the patients returned their fit right away and needed no reminders. And so you can think of that return rate is actually a 60%, approaching 60% overall. The other thing that's important to note is that the modality that was more effective for Spanish speakers, which was a combination of the automated and live call, was not the same for English speakers. So the modality that worked best for them was the live call by itself. We also note that text messaging was actually one of the least effective strategies, even though we believe it has the best reach. In this situation, it appeared to be the least effective for both the Spanish speakers and English speakers. So you may be wondering why I'm still promoting the use of text messaging. And this is why, because I think that we can actually innovate text messaging to include videos that can go a long way toward educating people to use colorectal cancer screening. And I want to show you a video that was actually produced by Annie Tebald and her team in South Carolina. And maybe you guys are familiar with this set of videos. We find them to be fantastic, and we've collaborated with her to translate them into Spanish. And so I'm going to show you a video in English and then the same video in Spanish.
Colorectal cancer begins in the colon or rectum from a small growth called a polyp. A polyp is a growth of tissue that is formed from a group of cells. Not all polyps will grow into cancer. Cancer happens when the cells in the polyp grow out of control. We do not know why cancer happens or how long it takes to grow. But through early detection and treatment, most people go on to live normal lives. It's important to talk to your doctor about getting screened for colorectal cancer. Colorectal cancer begins.
Let me see if I can advance. Whoops. And here's, I think, the Spanish version.
El cáncer colorectal comienza en el colon o en el recto de un pequeño crecimiento llamado un pólipo. Un pólipo es un crecimiento que se forma de un grupo de células. No todos los pólipos se convertirán en cáncer. El cáncer ocurre cuando las células del pólipo crecen fuera de control. No sabemos por qué ocurre el cáncer o cuánto tarda en crecer, pero con la detección y el tratamiento temprano, la mayoría de las personas tienen una vida normal. Es importante hablar con su médico sobre la posibilidad de hacerse una prueba de detección del cáncer colorectal.
And then here's another video that discusses colorectal cancer symptoms.
It's important to know that most people diagnosed with CRC had no obvious symptoms. However, some of the symptoms that can be related to colorectal cancer are rectal bleeding, abdominal pain, weakness or fatigue, unintended weight loss, or changes in bowel habits, such as diarrhea, constipation, thin stools, or unable to have a bowel movement. It's important to talk to your doctor about your health and any problems you're experiencing. I need to talk to my doctor. It's important to know that most...
Let me see if I have the Spanish one. Here's the Spanish one.
Es importante saber que la mayoría de las personas diagnosticadas con cáncer colorectal no tenían síntomas obvios. Sin embargo, algunos de los síntomas que pueden estar relacionados con el cáncer colorectal son el sangrado rectal, dolor abdominal, debilidad o agotamiento, pérdida de peso involuntario o cambios en los hábitos de evacuación, como diarrea, estreñimiento, excremento delgado o incapaz de defecar. Es importante hablar con su doctor sobre su salud y cualquier problema que esté teniendo. Necesito hablar con mi doctor.
So I'm just realizing that we have updated those versions so that the writing is also in Spanish. But anyway, it gives you a sense for kind of videos that are educational, that can really help support and motivate patients to learn about the importance of colorectal cancer, how it forms, and why screening is needed. We are working with a federally qualified health center that's headquartered in Los Angeles, who are sending out these types of videos to patients after they receive a fit kit in the mail. And so I think the one that they're sending, we have another one that actually walks the patient through the instructions on how to do the test. And so I think the fit is sent to them, and a couple of days later, when they are anticipated to receive it, the clinic sends a text message that gives them the instructions by video. So I think that's a really good example of using innovation to really help make text messaging more usable, because right now you're limited to a low number of characters that you can communicate in written text. And so if we can actually use videos, we can get a lot more information transmitted and hopefully educate and motivate low literacy populations on the importance of colorectal cancer screening. So the final example that I'm going to provide is the use of a photonovela. And so for those of you who are unfamiliar, so photonovelas are stories that usually have a loving nature, and they're formed by a succession of images, like photographs of characters. In this case, the same federally qualified health center is sending out photonovelas via text message. So these are screens that you can see on your phone. And it uses storytelling to educate and motivate patients to get screened for colorectal cancer. And they're working with a company that's combining these photonovelas with artificial intelligence guided interactive text messaging. And so a text might be sent to a patient saying, hey, did you get your fit test? And depending on how that patient responds, they'll get a stock response that uses artificial intelligence. And so it's a really nice system that can create an opportunity for patients to communicate. And you can also incorporate triggers for additional fit kits to be mailed to patients, or for somebody from the clinic to contact the patient if they have a variety of questions or clinical concerns that can't be addressed through interactive text messaging. So I'm going to show you the two examples of the photonovelas that were produced by this company called Impulse. And so this is one that features two women that are celebrating one of the women's 50th birthday. And they exchange a gift, which is a green dress. And so again, you see kind of the characters very culturally appropriate for this federally qualified health center. And you can already see up front just the loving nature of the storytelling. And then one of them, the older one, kind of broaches the topic of fit testing, that she's been doing her fit test every year for 8 years. And she asked her friend who just turned 50 whether she got one in the mail. And this is when the friend starts talking about some of her hesitancy to do the test. And what ensues is a conversation about its importance and how, and with the older character reassuring the younger character about why screening is really critical. And all this happens while they're enjoying cake and coffee. And then there's a defining moment when she, the 50-year-old kind of puts it on her to-do list, but the older friend kind of puts it on her calendar. And so really kind of emphasizes the urgency of the test. And then at the end, the younger friend is who's wearing the green dress that was given as a gift, thanks the older friend for encouraging her to do it. And I think what you see here is also it's very Latino friendly. You also see the importance of family emphasized in the final image of the woman walking with a younger child. And it just kind of gives you a warm feeling about, working in the garden, drinking coffee, enjoying cake, while emphasizing the importance of screening. And so it's a really, I think, a nice, effective story. The other story that was created by this company features two men who are driving home from work. And they're just planning to call a mutual friend of theirs. I guess they noticed that they just got a message from a mutual friend who is sick because he's found to have colon cancer. And so they pull over and they talk to him. And what the friend says is that he's weak, but he'll get through it. And he's just taking it one day at a time. And then the story goes on to say, what can we do to help? And the person who has cancer says, well, do the thing that I didn't do, which is get screened. And you probably have a fit kit lying around home. So just complete the test. And so you see the image of the test in this graphic in that screen. And then at the very end, again, you see kind of the importance of family and having kids around. And so the kids are calling him outside, and he's like, no, wait, I'm going to go do something for my friend Santiago. And he goes in and does the fit test. And so I think these are really nice stories that have been created that can be distributed through cell phones, essentially through text messaging technology. And in this case is combined with interactive text messaging. So just in conclusion, I want to say that patient reminders are an evidence-based strategy to improve rates of colorectal cancer screening. Text messages in particular are low cost, and they're an accessible form of reminders that can reach more people than other reminders. And I think it's really important to think about overcoming the limitations of written forms of reminders, especially for low literacy populations. And adding videos to text messages or photonovellas may further improve the effectiveness of reminders that can be delivered to a large number of people. So just want to acknowledge Ultimate Health Services, the Centers for Disease Control and Prevention, as well as Kaiser Permanente Center for Health Research. Again, we have a website that has lots of great materials, including a full set of these videos on mailfit.org, and those are all in English and Spanish. So happy to share those. And again, happy to share any other materials that we've created. You can reach me at gloria.d.coronado@kpchr.org. Thank you very much.
Thank you, Dr. Coronado. I was trying to find my cursor so I could unmute myself. But what an amazing presentation. Thank you so much for that. I mean, I'm reminded of the Buick commercial where the car pulls up and the guy says, "This is not your father's Buick. What you shared with us is not your father's text message." And this is great. It's a great innovation. We do have a couple of minutes, and I would like to give folks a chance to either type into the chat a question, or if someone has a question. I see Dr. Hotz's hand up. We'll go ahead and turn it to you. Dr. Hotz, welcome to the session, and unmute yourself and fire away.
Yes, thanks again, Dr. Coronado. It's been a pleasure working with you these years, and you're one of the leaders in this. And for those who don't know, she's got a bunch of publications about how do you get fit tests back, and how long does it take before a fit test you should get a colonoscopy. So is one of the real national leaders in research. The question I've got is, text messages are great, but quite often phone numbers change. What do we know in the literature about this challenge of connectivity and the changing of phones, especially with people that are living in poverty? Because it has proven to be a pretty significant problem for our group and others.
Yeah, I think it's a really good question. And, when you look at the data globally, and I know we're not talking, your question isn't global, but globally, more people have access to a cell phone than have access to a latrine. And so when you think about just the potential reach, it's huge. And I get that, people may change their numbers. I think they're changing their address too. And so I think that's an ongoing struggle is to see if you can, figure out how to, stay in contact with patients as a health system. But I actually think that more and more cell phones are actually more stable than address information. But I do think that health systems are needing to get into the habit of making sure that they have cell phone information. I mean, it used to be that we didn't have good cell phone information. We had landlines when those were popular. But we've seen this shift happen over the last decade where cell phones more and more are being captured in health system data. So I don't know if I have a specific, solution to the issue of churn, but I think that despite the churn, I think it's still a viable method.
Thank you.
Mm-hmm.
Thank you, Dr. Coronado. We do have a couple of questions in the chat, and I'm going to take this one from Heather Dollinger first. It's, have you received feedback from patients on their willingness to watch a video from a text message? Text messages are fairly low data and cost for patients, but not everyone has a data plan or internet where they might be able to actually watch the video. Have there been any challenges related to that?
Yeah, it's a good question. The clinic that we're working with has a little bit of data because they are able to determine whether, how many patients will view the video on text. And the way that they have this information is not at the level of the patient, so they actually can't link a given patient to their viewing of the video. But in general, I think they're seeing that about 50% of the patients are viewing them. They also have identified some possible ways to make them more attractive. And so at this point, the video is just a link in their text message, but they'd actually like to include an image of the video so that the patient can be reassured that they're not going to be just going to a random link through their text message. Like, because people get spam or other things. And so really reassuring the patient that this is a video might encourage them to view it.
We've got time for one more question from the live, and then maybe we'll hit on Kyle's last. Dr. Islam, I see you have your hand up.
Oh, thank you, Dr. Colorado, for a wonderful presentation, very helpful. One of the questions that I had, you already answered about the cost and data plan. Thank you for that. And the other question I have, you showed a slide that has the percentage of responded on by different interventions. One of them, the highest number was 40%, I believe, due to previous colonoscopy. So the other three categories that you showed, those three are first-time intervention group, or they had previous colonoscopy and they are reminding with those three other. So basically my question is the population that you were, whether they are all with the had the previous colonoscopy, or some of them had previous colonoscopy?
Yeah, good question. So I think you're referring to the image of Kaiser Permanente's data, where they reached 82% and 40% of that was from prior endoscopy. So if you get a colonoscopy, you're usually good for, depending on what they found, up to 10 years. And so that's why 40% of those screenings are being carried forward from prior years. And then 20% is from Mayo Fit, and then you get an additional boost from reminders, and then an additional boost from the MAs calling patients. And so the point of that was to say it takes a whole variety of things to get to 82%, but reminders are an important piece of the puzzle. So those patients who were covered by Mayo Fit or reminders were not part of the endoscopy group. So it's just a reflection of the percentage that is up to date by those different categories, if that makes sense.
I'm going to take a little prerogative here, and I'm going to ask Dr. Gibram, Cheryl, if you don't mind, I'm not sure I'm following your question that's in the chat. So if you're with us, if you don't mind opening your mic and asking the question directly to Dr. Coronado, I think we got enough time. I just wondered
if the texting platform you're using in your clinic is HIPAA compliant, and also does it have an ability to then take the texts that you've shared with the patient and store them in EMR for future conversation? We recently got into this business with our genetics program, and so I'm just wondering if that is something that all the clinics have and have access to? Because I think it's important if you can document it in the patient's record, the conversations you're having.
Yeah, that's a really good question. It is a HIPAA compliant platform, and so that box is checked. I don't think that the text-based conversation is getting back into the medical record, but it's a really good question and it's a really good innovation. What I do know is that, or what I've heard is that there are big EHR platforms like Epic that is moving more and more toward using videos for patient education. And I think the other important thing to note is that there's more and more interest in countering misinformation as well. And I think that health centers are going to be really called upon to deliver really accurate health information to its patient population. And I think that videos are a really good strategy for doing so. And getting them to patients through text messaging or the electronic health record. I think what we do see is that there are way fewer patients that have been able to successfully use patient portals. And so text messaging is kind of more of a proactive, outgoing approach.
It's great. Thank you. It's a great discussion. We've got one more out there from Kyle, but I'm about to introduce Kyle to do the case presentation. So Kyle, I may allow you the luxury of kind of following your case presentation with your question for Dr. Coronado, if that's okay. So it's my pleasure to introduce Kyle Kennedy, a nurse practitioner, Dr. Martin Sheldon, and Paul Dorsett, a physician's assistant from East Georgia Health Center in Swainsboro. And they're going to present today's case, the case study about their experiences in implementing various evidence-based interventions. So we'll have about 10 minutes for the presentation, and then we'll have time on the back end of that for discussion. Kyle, I'm going to turn it over to you. And again, I've got a placeholder on your question if we still have time at the end.
Hi, and this is Dr. Sheldon. I'm the Chief Medical Officer, and I want to thank Kyle for putting this presentation together and Paul's assistance as well. East Georgia Healthcare Center has 13 clinics that comprise approximately 7,000 square miles. Oh, there's the map right there in Southeast Georgia. And many of them are on, and I'm very proud of those who've been able to make this event as well. But you can see the county area that we cover and the various clinics that those serve those counties. And with that, I'll hand it over to Kyle.
You can go to the next slide. So this is a summary of 2021. As you see, the top number is all 13 clinics of the patients that we served. Below that, you'll see the number of visits in Swainsboro. And I believe, if we calculated this right, we had approximately 5,035 visits out of those 24,000 that were eligible for colon cancer screenings. And in Swainsboro, approximately 1,350 or so that were eligible. So next slide. As you can see, our UDS rates have kind of been up and down. From self-reflection, we had a big influx of new patients during the COVID pandemic, which hurt our numbers pretty significantly. What was the number? Sam, do you know how many COVID visits we had?
No, because all they could do is how many COVID tests were performed.
How many was that? I know that we were seeing roughly 60 to 70 patient visits a day that were just COVID. And I know that I, for one, was so busy that I would fail to even think about colorectal screening during that time with the drive-through visits. And I think that goes across all of our entire organization. Next slide. These is a breakdown of our clinics. As you see in the Mount Vernon clinic, they're performing about 50%. I know that they've had Sabrina Watkins, who's a physician assistant that's been with East Georgia. She's one of the longer tenured providers. And then Laurie Hutchins took over for her. And, you know, they do a very good job with their patient population of getting colorectal cancer screenings completed. They also have one of our higher insurance rates. Is that right? Coverage wise?
Yeah, They do a good job. And the other piece, if you notice, for instance, like Metter for January through March of 2022, just in 3 months, they've already had 88 people who have been screened successfully. In 2021, there were only 169. Now the percentage looks lower, but that's because it's the numerator is higher, but our denominator is higher. And that alludes to what you're saying, that we have a lot of patients who we serve in that 45 to 75 age group who are going to be tested for COVID, and they're part of our patient panel. And if they keep coming back, we will get them in to see, to be screened for colorectal cancer, but many of them not returned. So, hats off to Metter. They've in just 3 months almost have 50% of what they did all last year, though the percentage looks worse, 26 to 32%. You're actually doing a better job of recruiting patients.
And I think you can see that across the board. Just in the first quarter, almost all clinics have increased or have been about 50% of what they did last year.
Yes, in 3 months. Yeah, you're right.
All right.
Some more.
Next slide. So one issue that we have ran into is when we do refer patients for colonoscopies, we have had a delay in receiving a lot of our colonoscopy reports, pathology reports on these patients. Now, whether it's COVID, medical records, I don't know what the case is, but there's a lot of work on the back end that our medical records department, our medical assistants, the core group has helped us in trying to track these things. But I know that we're asking for release of information 3 or 4 times a year just to get one colonoscopy. So there is a backlog of reports that we have not received. And in fact, about a month or 2 ago, I had Sable, who's kind of heading up our colorectal program, print off all my non-compliant patients for the last year. And I went through each patient's chart, scrubbed their entire chart to find out, did they refuse to go through with the screening? Did they have a positive hematuria and were referred? Were they referred for a gastric consult? And a lot of these people did have visits. Some of them didn't have the colonoscopy. Some of them did have the colonoscopy. We just were failing to get the reports. So that's another issue that we have faced. Next slide. When we self-reflect in the Swainsboro Clinic, you can see like what we do well is we do get these patients that are eligible for their Medicare annual wellness visits and for review of preventative screenings. And that typically goes over very well. Obviously, these are insured patients, so typically they're more likely to do these things. But we have LPNs and RNs that assist us with that and spend a great deal of time, I would say about an hour and 15 minutes per visit discussing preventative care, which has helped us tremendously. Participation by clinical staff has been a success. The medical assistants have finally jumped on board and started pushing the hematuras more and more. And even myself included, and I would think the providers as well, we have gotten where we make it a point of emphasis, even at our sick visits, as hard as it is to get that across, because when it's a sick visit, the patient generally wants to discuss the sick visit. They don't want to talk about mammograms or colonoscopies or anything else. So we have gotten better about still mentioning that during the visit and then following up on it. And then in the Swainsboro Clinic, I believe we had a 12% improvement over the course of 1 year through the implementation of our patient reminders as well as provider reminders. Now, the failures we do encounter still convincing our patient population about the importance of undergoing screening tests. We have a really large group of Hispanic patients. And from what I understand, based on their culture, if it's not a problem, they don't address it. And then we have a large amount of patients that will agree to take the hematuria kit while you're in the room, and as you discuss it with them, and then you'll walk back in the room and the hematuria kit will be sitting on the counter, or we'll find it out in the parking lot. So we're trying to do a better job of educating our patients. Some other things we failed to do is duplication of screening tests. This patient had a colonoscopy 3 or 4 years ago. We have some people that we are still ordering hemistry kits on. We have family history of colon cancer that we are ordering hemistry kits on. Now, my thing is if they're not going to get the colonoscopy and they agree to do a hemistry kit, it will help, and it's something that's better than nothing. And then the other thing is congruency among providers and knowing the standardization of care, and also staying up to date on recommendations. I know that they change all the time, and you have to read, but that's our job as providers. And I would say that if we can get everybody more congruent across the board, that way, if you see Dr. Sheldon, you see myself, you see Paul, it's the same answer to every patient. I think that will increase compliance with patients. Next slide. And then obviously this is barriers that we all face, especially in rural healthcare, transportation, local access. Local access has gotten better this year. The local hospital has a new surgeon on board who has been very helpful in getting these patients in that do have positive hemistures and getting their colonoscopy done within, would you say, a week or two, say?
Yeah, they're getting.
Yeah, we're getting them a lot quicker than what we were in the past. Health literacy, again, I mentioned the cultural language barrier with the Hispanic population that we do serve, and then doctor-patient relationships. Like I mentioned with Sabrina and Lori, they're some of our more tenured providers, and they have the higher numbers in that Mount Vernon clinic. So a provider that's been in the area, that the patients trust, and that is willing to stay in that area and serve that patient, I think your numbers will continue to grow. So the next few slides are some questions that we came up with to discuss and kind of make it a open forum between everybody. What are some common misconceptions you encounter regarding preventative screenings? How does your clinic educate their staff regarding updates to preventive screenings? And does your clinic use the Medicare annual wellness for increasing patient awareness and education of these preventative screenings? And then what are some patient and provider reminders that have been used in your clinic to improve compliance rates? And that goes back to my question with Dr. Coronado is, you know, we have these TVs out in our lobby, we have these TVs in our room, we have iPads in our patient room. You know, those videos would be very helpful if we could have those play on a loop sort of, and have patients in the room where they can see that video, because that video was, you know, as simple as it was very informative for the patient.
Dr. Coronado, you want to respond to that?
Yeah, happy to share. Take a peek. There's a series of about 9 or 10 of them on our website under the videos tab. And so we are definitely happy to have them used in whatever way they can. We like to know to track it. So if you do end up using them that way, just send us an email and let us know.
And that's the mailedfit.org website?
Yep, mailedfit.org.
That's great. Thank you. Kyle, or Lorianne, if you'll back up one slide from question 4 back to, nope, back up one more, please. And one more. The question number 1, I'm going to call on someone who put a question in, Miss Jane McElroy, if you're still with us. If you'll make a comment about question number 1 based on the question you put in the chat. I think it's an interesting thing about preventive screenings and misconceptions that some providers and staff have.
Yeah, so I was just on a call with the National Association of Chronic Care Directors, and this came up where they're getting some pushback. Some of the clinics that they're working with are getting pushback from the Postal Service about not wanting to deal with fecal matter in the mail. in one of the states, and I don't remember what state that was. And then another person said they're actually having pushback from frontline staff at their clinics because they're having to open mail, and they're not happy about opening mail that has fecal matter in it. So there are two different avenues. Surprisingly to me, that there seems to be at this moment some concern about using the home kits.
Thanks for sharing that concern. Does anyone from one of the presenters want to comment on that? If that's been an issue for you, or?
Yeah, it definitely has been an issue that we've heard about. When we've talked to the FIT manufacturers about it, they've essentially said, you know, the post office is required to send these through the mail. And so they've really pushed back on any suggestions we've had about, you know, maybe you could use a sturdier envelope or what have you. So definitely, yeah, it's definitely something we've heard. And I think that more, you know, I think we need to notify post offices if we can, that these will be coming so that they can, you know, inform their staff. But from what I understand, they're required to mail them. In terms of front office staff needing to open envelopes, I think that's a really interesting challenge. I think in a lot of the clinics that we worked with, the front office staff haven't had to open them. They can just receive them and put them in a bin for pickup by an external lab. So, you know, there could be potential opportunity to explore the workflow there. I don't know what others' experience has been.
Let me comment. This is Dr. Sheldon. So I concur fully that the U.S. Postal Service has no business knowing what's in or not in a letter that's been posted. So that shouldn't be an issue. Now, when the envelope comes to us, we have a person who's specifically trained on how to open up and deal with that stuff, so to speak. And, you know, they use proper gloves and then do the appropriate testing. So yes, once it comes to our facility, it remains closed until it gets to that person who works within the lab to be able to appropriately handle, whether it's, you know, urine, feces, or blood. It's what we do in medicine. So, and to get the appropriate training.
Thank you, sir. I think we may have time for one more comment or a question. I don't see anything in the chat. Anyone else? Dr. Islam, Dr. Hotz, you both have your hands still up. I don't know if that's from before or if you've got something.
No, I have a comment to make on the item 2. How does a clinic educate staff regarding updates for Venom screenings? We have used the purple sticky note in the ECW, and we put that in there if somebody goes through and finds it's done. But one of the challenges, and it was mentioned earlier, is, you know, the need to groom the chart and to get colonoscopy results back in the chart. That is always one of the great challenges we have. I was just at the National ACP meeting and I asked the GI presenter, I said, you know, you got to mail out that final recommendation about polyps and next one due. And it is a challenge, and you end up having to actually do a focused outreach. One of the things that our crew does, Dr. Amin especially, is they scrub that chart, and it does require somebody to scrub the chart, get the result in there and plug it in, because as Dr. Coronado did show, you know, if somebody has had a colonoscopy and they're clear, it's a 10-year window. So it's very important to educate the staff about where to put the reminder in, and we've used the purple sticky note in ECW to do that, and also to have somebody to clean up charts.
Thanks, Dr. Hotz. And I think Robbie, who's also on the call with us, may have a personal witness to that process, because I think he was involved in that somewhat at APHC. Well, I'm going to call time on the questions and comments at this point so we can wrap up and keep in mind on everyone's time. But if we think today about what the key question for today's ECHO is, and that to me is a key question that revolves around this concept of, are patient reminders as an evidence-based intervention effective? And I think what we saw clearly today, and we've also heard from our case presentation, we've seen evidence that suggests that the low cost and significant yield for text messaging as an add-on to other forms of evidence-based interventions clearly is effective. And again, when we think about high cost, low yield, high cost, high yield, or low cost, medium yield, I think for the technology, this is something that we could surely embrace. And I also want to thank Dr. Coronado for sharing the website that has the resources that are open and available for us all to be able to access and to personalize and incorporate in our strategies, our layered strategies to achieve high levels of compliance with this. With that, I'm going to move on and let Dr. Desai talk to us a little bit about the CME credit. And I understand that the CME credit is available as of right now, as of this minute. So Dr. Desai.
Sure. If everybody, once again, you can pull out your phone, click the camera app and scan the QR code. I got a message that this is active code and you guys can use it for getting your CME credits. If there's any issues with that, let us know. And we'll try to sort through that. But this code is working right now. This link is working. And the activity code is also there on the screen. You can use that activity code and plug it into the link to get your CME credit. All right. Do we have a next slide, or are we going to keep that slide open? All right. Yep. So thank you guys for attending today's session. Thank you to Dr. Patton for leading us through this presentation. Thank you, Dr. Coronado, for helping us learn more about text messaging as a form of patient reminders. And thanks for Kyle, Dr. Sheldon, and Paul for your presentations, or Kyle and Mark, Dr. Sheldon anyway, for your presentations. I know I badgered you guys or volunteered you guys, and I think you guys did a great job. So thank you guys for doing that. We're going to need more volunteers for more case studies in our future sessions. So please reach out to me if you guys have anybody that wants to volunteer and do that. Our next session is Wednesday, June 1st. And that's going to be at the same time, 4 to 5. And so please, we'll be sending out links for that. So please sign up if you guys want to participate. So thanks again for everybody to attend. For everybody that attended, I know you guys have busy clinic schedules, so we appreciate your participation in this educational session. So everybody from your clinics, you guys can sign off now. For everybody on the hub team, you guys can stay on and we'll do a follow-up session.